Dr. Purvi, before we go into discussing about the impact of COVID-19 on children, which is why we really want to have you on at ITV Bold today, I would like to quickly reflect upon the 100,000 deaths of COVID-19 that the country is currently approaching. Did you ever anticipate a number this big, and how should we process this number right now?
No, it's quite a large number. It's much larger than 9/11. It's almost as large as some wars, that have gone on. So, and this is only after the first wave. We have to remember that we still don't have a good vaccine or fail-proof treatment yet. So that number may even go up. So it is very, staggering. And I don't think anybody expected it to be that high. But one way that we can pay respects to all those people is by, everybody doing their part. So everybody, wearing masks in public, social distancing, just being responsible so that we don't see that number go higher.
Right. And is this curve truly flattening, as we've been talking about in our previous interview as well with you? We were looking at the curve bending at that point. But at this point, is it flattened? Are the number of cases less? And if so, with reopening as such a big question right now here, especially in New York City, what do you predict?
Right. So here in New York City, luckily, the curve is flattening and it's even going down. But the problem is in other places, actually the opposite is happening where the curve is going up. So that is a big problem. So it depends where you are. So again, even though it's good news that the curve is flattening and coming down in New York and New Jersey, in the tri-state area, there's still so many other areas where the opposite is happening. So we still have to be very, very careful.
Right. So in that terms, what are you expecting a surge? A resurge of COVID-19 cases? We are talking about, certain health officials also stating that there is a possibility it could happen again. Do you think reopening could cause it?
Yeah, so it could if we reopen too quickly and if we don't do it in a responsible, methodical way, a second surge could happen. That's a very real possibility because as we saw 100 years ago with the Spanish flu, it was actually the second wave that was the deadliest wave and the worst wave. So that's why it's very important that even though everybody is impatient, that we open slowly, gradually, and do it in a way that we don't have that second surge again.
What are some of your biggest concerns right now, especially for this week?
Right. So the biggest concerns is as things start to open up. So in New Jersey and certain areas of New York State, we're going to have to keep a close eye on the numbers and make sure that, again, those cases are not going up, the deaths are not going up, and that, people are being responsible. I mean, I've noticed even since between this weekend and today, the streets are a lot more crowded, actually. So I don't know why that is. And there's a lot more cars on the road, people on the road. And not everybody is wearing a mask. I mean, majority of people are, but many people are not. So that really worries me that if everyone doesn't do their part and take this seriously, I don't want to slide backwards.
Dr. Parikh, let's talk about children because we really want to sort of reflect on what's happening. It is concerning. It is alarming. Suddenly, there are about 26 states in the United States of America that are investigating these inflammatory syndrome that is being found in children. Could you reflect on what exactly this is? And they're saying it's similar to Kawasaki disease. If you could just educate our viewers on, what is happening in terms of that, that would be really great.
Right. So every virus has the potential, besides infecting you, to trigger your immune system and make it have an excess of inflammation. And often, it's not even the infection that's the worst part. It's all the inflammation that comes from your immune system that's actually very deadly for any virus, whether it be the flu or COVID-19 or many others. But what is interesting is that, we knew that adults were getting these inflammatory syndromes, one of which is called cytokine storm, which led to them having multiple organs involved of just a big release of inflammation by their immune system. But now we're seeing it in children, which is surprising because up until recently, we thought that the children were overall protected and that they got much milder cases of the illness, and they didn't get this big inflammatory response. So it's interesting that it's happening so late, and we were thinking maybe it could be a delayed manifestation of COVID-19. We don't really know. So we started seeing these cases in Europe a few weeks before we started seeing them here. And now we've seen, a couple hundred actually in New York State, and a few children unfortunately have passed away. But it does resemble another illness that's triggered by infection called Kawasaki. And that's also similar concept where it's your immune system goes overactive and it's overly inflamed, and it can affect your heart, your lungs, your skin, your lymph nodes. And so similarly, this also can affect multiple organs. So that's why it's very important to catch it early and make sure the child is in a hospital setting where they can be monitored closely and get the right treatment. But the good news is children actually are doing much better with these inflammatory conditions than the adults. So most of the children who've had these mysterious syndromes have actually recovered, especially if they're treated early and aggressively. So, it's not meant to scare people, but, some warning signs that parents can look for is if they have a fever for many, many days, or swollen lymph nodes, or rash, red eyes. Sometimes you can get vomiting, diarrhea, and you'll know your child just seems off. It's not like the normal virus, because kids get a lot of viruses, but they'll seem very restless or listless.
In terms of children that had COVID-19, Dr. Parikh, and they, recovered from it, is this a worrisome scenario for those patients or patients that could have some symptoms showing of COVID-19? How does that play with this inflammatory disease?
Right. So we don't know exactly what triggers it and why some people are more predisposed than others. Not everybody with this inflammatory syndrome has been testing positive for COVID-19, and that could be multiple reasons. One, we know that the tests aren't that great yet. And we also think it might be, like we were saying, a delayed manifestation of it, but some are testing positive, and enough are testing positives that we think that there is a strong association. It's too much to be coincidence. And then we are seeing, for some reason, a stronger predominance in African American and people of Caribbean descent, but we've seen all different ethnicities affected. So it's really hard to say who will get it and who won't. But again, the great news is majority of children either have no symptoms or very, very mild symptoms from COVID-19. So this is still extremely rare.
Is there an age bracket or an age group that's being more impacted according to the recent investigations on this?
Right. So we're seeing anywhere from like age 5, we even saw some babies, all the way up to teenagers, so adolescents and teenagers. And so that's a little bit different than the typical Kawasaki disease. That usually is around toddler age, age 3, 4, 5. But we are seeing children much older than that, as well as younger too. So it seems like there is a wider age range with this inflammatory condition.
And is there a concern for newborn children? There have been a lot of, investigations also being done on the impact of COVID-19 on pregnancy. What have been your key findings, and what could you tell us about that? Right.
So newborns in general are at an increased risk for all infections because their immune systems are still developing, especially if they are born early or premature. So, in all newborns, we have to be extra careful. In fact, we don't even let certain visitors come see babies unless they've all had their vaccines and whatnot, because we just don't want that child to be infected. And there's a lot of vaccines and things they can't get, that young. So in general, they are more at risk. So they need to be carefully watched, protected, limit contact with many individuals if possible. Now for pregnancy, we don't have good information yet. So we don't know what it means if like the mom has COVID-19, what will happen to the baby. Now there are pregnant women who have gotten sick with COVID-19 and had babies. And so far, everything is going well. We haven't seen what we call transmission from mom to the baby. So that's good news. So there's no way that your baby inside of your belly can get it if you are sick with it. But, once the baby is born, anything is possible. They can catch any virus.
In terms of this inflammatory syndrome that we're talking about, Dr. Parikh, do you predict or do you anticipate this to be a really major concern for the nation? You know, just a few weeks ago we were talking about just a couple of these cases, but now we're talking about a few hundreds of these cases. How should we sort of understand this?
Right. I think the main takeaway is that, our initial thought about children being, more resilient to this virus or more immune to this virus, it's not that it's wrong, because still overall kids are doing well. But it might mean that we need to be more careful in how we reopen schools when that time comes, because the children aren't as protected as we thought they were. So I think that will be the biggest takeaway, that one, we have to be careful about looking for it. And now we have to be even more careful about reopening schools. And that might change when we reopen, how we reopen, as we learn more about this.
What's your advice to parents? What could they do to perhaps build immunity and nutrition and wellness in their children?
Right. So, I get this question a lot, and there's no magic pill, for immunity boosting or nutrition boosting. The most important thing, which I know is difficult to do in times like this when there's a lot of stress that you're out of your routine, but the most important thing is eating a well-balanced, nutritious meal, avoiding junk food, processed food. All of those things are really bad for your immune system. And then getting enough sleep, getting enough fluids, hydration, and exercise too. So I know many people are stuck at home, but it's really important to make those efforts, because that can go a long way for your immune system. And there are certain, vitamins that do help, but you can get those in your daily multivitamin. You don't have to take mega doses of anything. But in general, vitamin C, zinc, vitamin D, like dog, is very good for your immune system. But again, it's not about a magic pill, because if you're not doing those lifestyle things, no amount of vitamins or pills will help.
Dr. Parikh, what is your focus for the next few weeks now? Now that the curve is, it's flattening, we're seeing some decline number of cases. What is your focus?
Right. So, our focus is mostly looking at, the safest way for us to reopen. I've been seeing patients throughout, but, it's been at a much limited scale because we don't want to expose people unnecessarily. But at the same time, we do want to be there for certain patients who have emergencies so that they don't end up in the ER or the hospital. So, we have to take those things into account from a professional level. I'm also looking to see what happens with the numbers in general, or in New York, in New Jersey, in the US, because that will tell us what's going to happen in terms of any new surges coming or second waves coming. And then I don't know if you knew this, but I'm involved with some of the vaccine trials. So
Oh.
I'm hoping as we get, more information there, I mean, that will take much more time, unfortunately, but I'm hoping it makes me feel good that hopefully we're moving towards something that can protect all of us, at least, by end of the year or beginning of next year.
Could you give us a little insight into this vaccine trial if you're allowed to speak on it?
Yeah, I mean, can't give too many details, but we are doing multiple trials at NYU. One is industry-sponsored trial with Pfizer, and again, we're studying the COVID-19 vaccine, the mRNA vaccine, and then also, I'm sure everybody has heard of the Moderna trial
Yes.
that the NIH has partnered with. So, in a couple of months, we hopefully will be enrolling many patients for that trial too, because we're trying to see as quickly as possible how safe and effective it is. So let's see. I mean, I don't have any new information other than that, but at least the good news is that people are trying, and many different institutions are trying to get good data fast, so we can decide what is safe and effective.
Today, actually, the top health officials in the US said that there could be a vaccine possible by December. Any comments on that?
Yeah, I mean, if there is one possible by December, that's extremely good news. The problem with vaccine studies in general is they take time, and rightfully so, because we want to, one, make sure something works, and we want to make sure it works for a long time. You don't want a vaccine that will only last a couple of weeks. And two, you want to make sure that it's safe. So we want to make sure that, whatever that we're giving people doesn't have too many side effects. And so far, the results are pretty promising. even from the Moderna study, it's only 8 patients, but overall it seems safe. And it also seems like they're getting a good immune response that hopefully seems to be working against the virus. But, only time will tell. The other problem is too, your immune system doesn't work overnight. So if I get a vaccine today, it will take me a couple of weeks before I can make those antibodies to fight the virus. So again, it takes time. It takes a lot of people being enrolled, because we want to test it in all sorts of people and with all different backgrounds and ages. So that's why it takes a long time. But December, I think, would be great. But we need to be ready in case it takes longer than that, because that's another possibility.
I appreciate you for sharing such insightful information. I think it was very important for our audience to get an insight into what's really happening in terms of vaccines, especially. Thank you for your time here on ITV Gold. I would love for you to give one last message to our audience.
Right. So I think the last message I would give is, we're moving in the right direction, but we're not out of the woods yet. I know it's very nice outside and there's an urge to, go back to normal, but now more than ever, it's still very, very important to take all the precautions. Don't let your guard down. Keep the masks on, practice social distancing, listen to the state officials. Please avoid crowded places and unnecessary travel, because if we're careful the next few weeks, we can get past it. But if we're not, then we're going to be stuck right back at square one, which nobody wants.